Hi, and welcome back to Becca Babbles podcast. I'm your host, Becca. I'm a certified personal trainer, holistic health coach, and future chiropractor on my way to figuring out this thing we called life. Now, let's get babbling. Hi, everyone, and welcome back to Becca Babbles podcast. This week, I have a really exciting interview for you guys to listen to with my old CFD, Dr. Brandon Beckerman. He was my CFD in student clinic at Parker University when I was in Tri-8, and we've had so many amazing conversations about clinic, about patients, and honestly, just everyday life that I was like, you know what? I need to have you on my podcast. And so we're going to go into all things chiropractic, exercise, and even research. I really wanted to have him on because I know he in school started a research club, and for me about to graduate, I want to make sure that I'm reading the top tier research that can help benefit my future patients. So if you are a student, future clinician, or a clinician already, this is going to be a great episode for you, or someone who just is your everyday person and wants to understand research even more so you can figure out maybe what's going on in your body or within this world. And so we break down exactly what does it look like to actually find good research, and what does good research look like, and how does that evolve throughout your everyday. And then we also talk about how to implement exercise into your everyday life, and also the benefits of isometric exercises. So if you are an everyday person who's just trying to get into an exercise routine and boost your strength, we talk about how to use that with isometrics. But then also, if you are rehabbing someone in clinic right now and you're like, I don't know what to do, isometrics may be the thing. And Dr. Brandon Beckerman breaks down exactly why he loves isometrics so much and what the benefits of them are. I will say, sadly, we did have some internet connection issues throughout the podcast. I did as much as I could with the editing process, but there may be some clips here and there where we had some interruptions. And towards the end of the podcast, you'll maybe hear his son in the background. So make sure you stay tuned for that so you can hear his sweet little voice at the very end. But with all that being said, I can't wait to hear what you guys have to say about this episode, and I can't wait to babble with you next time. Because I'm a chiropractic student, I always love to hear how chiros got to where they are. So could you give me a little bit of background as to how you got to where you are today?
Of course. So actually, uh, my first interest was engineering, mechanical engineering. And so my father's a mechanical engineer. I was into cars and anything and everything, computers growing up. And so when I was initially going to engineering school, the kind of the plan was to go to KU. Um, I kind of felt like I don't know if I can sit at an office all day. You know, already like sitting down to study and kind of grinding that out was already not grinding it out and studying, but it was the sitting that I just felt like I don't think I could do it. Um, and I was already into health and strength and martial arts and everything when I was growing up as well. And so I kind of did a little bit of more of like a soul searching, if you will, and found out that chiropractic is kind of melds the two together where you can do a lot with it, um, and it's still mechanical in nature. And I've had some really great chiropractors too in my hometown of all places, in Hutchinson, Kansas, where they practiced for a while, for 30, 40 years. And so that's kind of what inspired me to go forward with the chiropractic route. Um, so, and then throughout chiropractic, a lot of my, through my education anyways, my minds kind of shift from left to right to both extremes or even in the middle. It was a kind of a whirlwind, which was really cool, just because that's really got me interested in like just the process of critical thought and research and what's true, what's not true, and does it matter if it's true, and everything in that regard. Uh, and so that's kind of the gist of how I became a chiropractor.
Yeah, and I'm really grateful for it because having a great CFD is awesome.
I appreciate that.
You had mentioned that you went through like this back and forth whirlwind of like, I know chiropractic is a space where it's like you can be on one end and you can be on the other end, or you could
Yeah,
be somewhere in
absolutely.
between. What did
Yeah.
that process look like for you?
So let's see. I mean, we have the time, so a lot of it was I had my own idea of what chiropractic was, and it was a very simplistic thing of adjusting, and that's about it. And I'll all the other things that I kind of want to do in regards to nutrition and strength stuff, I'll figure it out on the way. I had a good buddy in school um, who was very extroverted, and at the time, it was difficult for me to make friends and talk. And I know that's kind of weird right now, kind of knowing who I am right now, but back then, um, it was uh, I didn't talk to many people, and so uh, when I had a good friend, and I started making friends with everyone else that he was kind of bringing in. Um, it was interesting to kind of see the extremism, even this was like back in 2012 ish, of only adjusting. Adjusting is the only thing that we need to do, and it'll cure everything to cancer. And back at this time, practice management groups were really huge. So like Maximize Living and I don't know to name names, I guess. Um, but see that influence of practice management groups on students, and I mean they were very very charismatic, uh, and some of the things made a lot of sense. But something in me just felt like it was a lot of it stuff was wrong. Um, and so I started talking to more people within the realm of, I mean, I call it right now the realm of evidence, right? But I was like the different people like doing the rehab, the strength stuff, um, saying things like adjusting is not, sometimes we don't need to adjust. And that just to me felt more true, even though everyone around me thought that was crazy. Uh, and so uh, it was one of those things where I had to be okay with um, the dichotomy of everyone around me is wanting this one thought, but I kind of had to go my own way and learn how to read research and um, identify what critical thinking is by myself initially, and then of course made friends from there. Um, and so uh, and of course, once you kind of learn how to read research, then the nuance you have to figure out what the nuances are, what good research and bad research truly is. And
Mhm.
so even then, you get I don't want to don't get tricked. That's not fair to say, but you do get charmed by the idea of uh, one thing being more. Uh, Being able to do more than what you truly what it's doing. Right?
Yeah.
Whether that's adjusting or quite honestly, whether that's um, strength training or exercise, right? Or manual therapy. It doesn't have to be one modality that we use. Um, it's just trying to get away from a school of thought that makes thinking and decision making easier versus working on the actual critical thinking to make that skill set creating systems to make a clinical idea or a clinical a picture simpler.
Yeah, it's going from being A plus B equals C to like sometimes A plus C equals B when it
Yeah,
doesn't
right.
really make sense. Yeah. And going against the grain can be really difficult, especially when you feel that gut feeling. I know there's been multiple times in my life where that has happened, and you're like, am I going to choose to go along with the crowd, or am I going to like figure it out myself and hope
Right.
that other people are going to be along the way with it? Yeah.
Right. But the thing is, if whenever you feel that way, you're not the only one that has that one unique thought. There's
Mhm.
always somebody else, and if you can find that one person, then it doesn't feel so much of a burden, if you will, like a lonely island.
Yeah.
Um, and so, or at least to me, anyways, right? But yeah, man, it can be tough, especially as a student. Especially now, you have Instagram that's so popular and YouTube. There's so much just information, whether
Mhm.
it's wrong or good or bad. There's just so much, which I think is overall a good thing. But I mean, if you don't have a direction, you can get pulled in many different ways.
Direction and clinical think or like critical thinking is where it all comes back to, and having your own personal thoughts on things.
Yeah, right. You got it. And being comfortable with being wrong and being and learning how to communicate those thoughts.
Yeah.
It's an entire. I mean, they're all different skill sets that um, uh, you you have to kind of learn and troubleshoot along the way, and
Yeah.
you'll do
And
that throughout the rest of your career.
I know you had mentioned to me that you at your school started like a research club
Yeah, yeah,
because research was something so important to you. And we had mentioned that there's so much information out there, and even myself trying to read research, it can be really overwhelming, and just the
it can.
learning process of having to figure it out. When you started developing that research club, what was like the first couple of steps you would take someone through when they're trying to get into research and understand it?
Yeah, that's a good question. Honestly, I had a couple of buddies that were really good with that, and one of the teachers we had like a intro to research class. His name, I don't know if he still works at Cleveland, but his name is Dr. Mark Pfeffer. Um, he's he was funny and he's amazing. And he was a really good guy. Um, and so, part of the process was just going through research articles and just trying to appraise them as students. And of course, he was there just making sure, as anyone would, making sure that we're on track. But um, uh, pulling up like a good article and perhaps even a one that might be that might need a little bit more work, right? Or what? I know one that was really popular was how adjusting improves uh, uh, immune function or increases immune response by like 500% or something like that. I don't know if that's still buzzing around, but that was a really popular one when I was going through school. Uh, and so if we had an article like that, we'd talk about like, so let's say if this was the case, uh, we don't know if it's a local thing or a systemic thing. We don't know if how long it lasts or if it's just a very acute a situation. Um, and then, of course, you would have some type of local immune response because there could be a very high possibility, a chance of a micro trauma that's happening in the area, depending on how low or how high you go or hard you go, right? And then everyone talks about how you want a higher immune function, which is all great and dandy, but some of the cancers uh, provide or show up as a 500% increase to certain immune cells. So are we then saying that the adjustment gives patients cancer? And so I think that one I remember a lot, it's kind of like hardwired in my brain because uh, you could see just a bunch of just lights turn on in a dark room where like, oh man, I've been thinking about this all wrong. Uh,
Hmm.
and that was a huge, um, a pivotal moment in, I think, a lot of people's just appraisal of research, and don't take things to face value, even if it's on a published journey.
Yeah. Like go more into just reading the title and the abstract.
Yeah, right. It was just like, why do you think this is occurring? And do we need to pull up more articles to understand that particular concept? And it might even be like one sentence, two sentences in the article. Um, and so that was another thing where we kind of tried with, again, it was a brand new club, right? So and he gave us a lot of leeway, but it
Hmm.
was one of those things where um, we try to pull concepts from uh, other larger concepts and trying to show people that, man, things are a lot more complicated than what we realize. Yet, because we do the looking into this, we can simplify it. And
You got to
that was
understand the
kind of
bigger
the hope.
picture.
Yeah,
Yeah.
right. Yeah.
Understanding the bigger picture to then get down to like the minute of understanding what's actually
Right.
going on.
Like
Yeah.
niche stuff and minutia, it's fun and everything, but most of the time it doesn't matter.
Yeah. When you had said that you would compare like a good piece of research to like a bad, not bad, but like a lower quality piece of research, how would you
Yeah.
define that? Like, what does that look like?
Yeah. So that actually, as weird as it sounds, changes a lot. So, but overall, we can kind of define that by making sure that the groups are appropriate. Uh, and so if we have appropriate uh, groups with the exclusion criteria is all mapped out, or if the intervention is very pointed and mapped out, um, that's usually a good sign. Sometimes, sometimes the conclusions, if you just go down to the conclusions and you read it, but then you go through the whole article, sometimes the conclusions either are sometimes like more negative or sometimes
Mm,
way more positive than what the actual study is showing. Um, and then as if you go to like conferences like the Pi conference and other seminars that might have some research portion to it, there's a lot of complicated math that can happen to distort the information. So just trying to learn and be familiar with those trends, um, or like a pattern recognition, if you will, and then it's trying to is
yeah.
is something that can be pretty handy to learn. There is something that I've been using ever since November, the Pi conference, which is something called the AmStar 2 criteria for systematic reviews. Um, and of course, like the whole thing is to hopefully find. I mean, the goal is to have no risk of bias, but we're humans, and that's not going to be the case. However, um, showing the least likelihood of bias. Uh, and some of it as simple as, making sure the review shows the uh, exclusion criteria of why we're not considering this. Um, and that in itself can be pretty disheartening if they don't label it.
Yeah.
So
Could you give like
you
an
learn.
example of like what an exclusion criteria would look like in a situation?
Oh, sure. So exclusion criteria would be anything from a, I mean, anything from age to a portion of someone, if they're trying to do a study on shoulder, let's do rotator cuff tears. And so uh, if they talk about not being able or not including people with diabetes or people that do have diabetes or maybe someone that's symptomatic versus not symptomatic or someone that's a complete tear of the supraspinatus, of why they're not, why they are including it or excluding it from the study, particular study.
And is that important because we don't want as many like factors or variables like
You got it.
affecting the study? Okay.
You got it. Right. Yeah. So let's say if I'm trying to figure out a mid 40s patient, the if I have a complete tear of supraspinatus, um, or let's do a more recent one like a subscap. Uh, what's the outcomes of this patient if we do just rehab versus do we need this is a surgical patient? And this that stuff is actually very hard to find. If you have a healthy 40-year-old patient that is relatively strong, that doesn't have diabetes or any heart conditions, all of the, especially for just complete tears,
Mhm.
um, you can't find that, and so you have to kind of dig a little bit more and have a few different articles of okay, well, if the subscap tendon in 65-year-olds, they do pretty okay uh, without rehab, but then I have a 40-year-old with no like diabetes or anything, so you kind of have to make a critical thought process of that.
That makes sense. Yeah. So, because I know so many people are always talking about how, oh, well, research, like, it's such a long process and, like, it takes once we, like, actually know something is true, then, like, everyone kind of knows that it's true. And so what would you tell the person where they're like, that research either takes too long or, like, you need to have your own like, clinical thought process when it comes to either A, being in the clinic or, like, dealing with your own health issues, but, like, also then applying research and not just, like, saying everything is true. Does that make
Right.
sense? Yeah.
Yeah, I think I know where you're going. Quite honestly, research is really quick. Once you understand, and it's the thing is, it's trial by error, and talking to others that are just light years ahead of you, right? Because uh, the people that are in the like research, right? Um, they're wanting to have these conversations. They love getting into the nitty gritty of the detail. So I'd say once you have a good couple of sources that understand the um, details front and back, pick their brains, and then once you have a very foundational understanding of what you're trying to do, and that you yourself is at risk of bias. So trying to take account to your own bias. I think research is actually really easy. Um, you the internet, like especially Google. If you type in scholar at the end of it, say rotator cuff tears, you know, uh, surgical versus non-surgical outcomes, scholar.
Mm.
And then you click on the like PubMed article. And then on PubMed you have other articles that you can read that's associated with it. And so, man, if you have time to read a biased blog, you have time to read an article or two.
Yeah.
And so uh, I really, reading research is time consuming. Reading research isn't. Um, and it's just, I think that's what the time should be used for in school, is trying to really be able to identify what you want to read and how to read it.
Yeah, I think nowadays it's just getting people from like not just reading on like Instagram, or now I guess it's TikTok, posting the
Yeah,
tiny snippet of the research paper, because research papers like honestly like are not as entertaining or pretty as
you
someone's
got it.
stylish Instagram account. Um and it takes, at least for me, it took time to like actually understand like the wording of research and how to read it. But once it, like with anything that is valuable, it takes practice, and
Yeah,
it eventually ends up being more helpful than the thing that you did
absolutely.
before.
Yeah, and that's just it. It's a skill set. It's a practice. It's not like a one and done deal. Um, I mean, it's very interesting with also to the just the thought process, how cycles of thought processes
Mm.
uh, happen as well. Um, so it's kind of cool and strange to see at times, but that's how it works.
Yeah. I know one big thing you're into researching is like general strength for the population. Oh, we got a friend.
Yeah, we might. We'll see.
uh, um, I know one thing that you're really interested in is researching for general strength for just um, the general population. Let's say someone wants to start off in the new year and they want to like start getting back into shape, and they realize that building strength is important. What would you tell that person, and how should they start?
Uh, well, with general strength, if they're pain free and they're just trying to figure out what to do, um, start with something that you are either familiar with and want to move forward with it, or if it's something relatively new, uh, make sure that you are interested in it. And so I think interest and wanting to do a certain activity is um, the part of the most important thing
Mm,
when it comes to uh, general strength in population, as if you talk to a general population. So, I mean, if it's pickleball or strongman or Olympic weightlifting or CrossFit or anything in that regard, um, if it's something as difficult as CrossFit, just make sure that you're that it's an ever evolving thing, and that the your initial skill set every year are going to be different, and the thought process will be different. So I don't think there's, especially for the first like year or even two, there's just so much general skill set acquisition that can be used for anything, that as long as you stick to something that you like, um, don't worry about the nuances.
so you're
Um,
just saying like just get started doing something and you'll
get started
create
doing
something.
something.
Yeah.
Yeah, get started doing something, and then I mean, I would also make sure to add a little bit of difficulty, or if you're not ready for the next step, at least get, you don't have to be 100% ready to do the more difficult thing. Um, uh, just because uh, uh, with skill set acquisition, there needs to be a certain part of what you're doing that needs to be difficult in order to learn it. Um, Also, too, there's a lot of really good, interesting research about um, novelty with movement, or novel movement and pain modulation, and also too just learning and the skill set acquisition in itself. Um, so I think we have to just pay respect just to the um, novel movements that will happen during
Yeah.
the first couple of years. So
It's like with learning any sort of skill, it's like you need it to be, I'm almost thinking back to like when you're in like first or second grade and you're trying to learn how to read or write. It's like they have to make the reading level and the writing level hard enough so that you pay attention. But
yeah,
then it like can't be too hard to where you're then frustrated and don't want to do it anymore. Because then that's
right,
where you have kids that don't pay attention.
right. Well,
Yeah.
yeah, don't pay attention, or to either degree, right? Where it's too difficult, so they peace out, or it's
Hmm.
too easy and they're um, and so I mean, I'm sure we could definitely talk about that, but that's probably another podcast.
That's fair. Um, when let's say someone's like, okay, I'm walking into the gym for the first time, are there certain movements that you're like, you need to learn how to do this?
If in a perfect world, um, man, that's tough to say because let's talk about a rehab setting.
Okay.
Um, where if someone is going through an issue and, and there's maybe they have old injuries and something new popped up, or anything in that regard, I do think there's a basic movement patterns that we have to pay attention to. Um, so things like a vertical press, so vertical and horizontal press, vertical and horizontal push, squat, hinge. Um, I think we don't pay to. I think we need to pay more attention to a vertical and horizontal lunging. So like
Mm.
stairs or large step ups, or lateral movements. And I think we're getting more attention to spinal rotation and being more okay as a field, as a medical field, being more okay with spinal rotation, because that was a huge no-no when I was going through school, right? But um, I think trying to regress and progress those movements, um, and being intentional with that, a lot of athleticism will just come naturally from there. Um, uh, and so, but if you are, if you're not going through any pain, and you're just trying to get more strong or coordinated or anything like that, um, I really so depending on the skill of the patient, right? Um, I think things like isometrics and tantrums and um, certain eye coordination drills are very, very, very important and not commonly performed, which I feel like it should be the first thing that you should
What
try.
are what are tantrums?
Tantrums are, I think there's other words for them.
Yeah.
I initially called them, uh, was initially introduced to them as tantrums. Um, but I like to do tantrums at end ranges. So let's say in a patient's that are needing to throw, you would get them in the position that they needed to be in, like the end range position that they're going to throw in. So if they're all the way cocked back, you have, I like to do like a band around something bolted to the floor or something that's very, very heavy. And the band is a very narrow, narrow oval. And so you put your hand in between the bands and you get them to end range, and then they slap the band back and forth
Mm.
and let the band kind of push them back. Um, as they're controlling it, but also too in a very uh, narrow range of motion against harder resistance at those end ranges. So you can do that primarily with a shoulder, or with hamstrings is another one that's really common to do that with. But you can do that with any knee or hip situation. Of course, you can't do it with spinal stuff. That'd be crazy. Do it with your neck. But I'm sure someone would. Um, write a
Is
paper
that
about it.
just to like develop more range for in that joint, or
It's to develop uh, being used to being insulted in that end range, and so in a kind of in a sandbox. That's how I think about it. It's so um, because you there's a lot that happens during a throw or during any other explosive movement, if you will. Um, People just aren't familiar with the end ranges, or the eccentric portions of whatever they're trying to do. Um, you put yourself in a nice little play box, a little sandbox at those end ranges, appreciating just what that joint feels like when it's being worked well. And so um, I think it's safe to for the kind of like the safe progression from pails and rails and things in that regard, depending on how athletic the patient is.
yeah, it kind of sounds like it would be a really good warm up, at least for the hamstrings, before you're about to go and do like some sort of sprint. Because I know a
Oh
lot of
yeah,
the times when like with sprinting, like a
yeah,
lot of athletes end up pulling hamstrings,
you got it,
and that gets it ready to be more explosive.
you got it. Yeah, and especially so. What's it called? The body blade or something like that in throwing athletes, where it's a large um, uh, thing where you grab the middle of it and you go to an end range and then you shake it, and then it'll give you resistance from there. It's the same thing.
Hmm.
Um,
Okay.
and so a lot of baseball players use it. Um, but absolutely, it's trying to uh, bring the again. I think of it as like an insult. It kind of just warms up that insult that happens during the uh, activity of your choice. And so, and that's kind of where injuries
Yeah.
happen, is during like the eccentric loads, or during a if you're needing to move in a way that you haven't been moving, uh, you know, and so trying to at least get the tendons and the musculature and the nervous system ready for that type of feedback, if you will. It's probably a better word than insult, but again, it's I you know, it isn't where I feel like with that word insult is something that I need to think of it a little bit differently, but I haven't found a better word that uh, explains what I think is going on in those regions. It's just a lot
Yeah.
of like feedback, if you will.
The like interference and the throwing with the baseball. I'm pretty sure, I can't remember if I read this in a paper or something, but it was talking about how like most baseball players don't throw like in the same pattern or the same path every single time.
Oh yeah,
And
right.
like to me, I know for like people moving on a day-to-day basis, where or like even in the gym, we're always so focused on like my barbell back squat has to be perfect like this,
Sure,
and like especially when we get to extreme loads, like yeah, that makes sense. But
sure.
like in everyday average life or even in sports, like you're not going to be as particular with that, so your body needs to be able to like handle different directions or like different forces applying to your
Absolutely.
joints. So that makes sense why that would be so helpful for baseball athletes.
Absolutely, and also too, it depends on the load. Your body's going to change or adapt to whatever that load is at that time. So, let's say if your squat max is 600 pounds, the 300 pounds is going to look significantly different than what a 600-pound one rep max squat's going to look like. Um,
Mm-hmm.
and so I think getting hung up. And that's another thing too that a lot of I don't even say everybody, the general population and athletes get really hung up on perfection of a posture or of a motion. While there's a spectrum there, right? Of course, meeting in the middle, there is a way or a concept to follow, but what's really, I mean, some of the things that's kind of popular, let's say in the powerlifting and deadlift realm, is rounding back, the rounded back during a deadlift. It's like you need all that support. You need that, not just the intra-abdominal pressure, but you need the spine to be absolutely locked in. And if that makes in your body structure and everything in that regard, and that's if that's how you've been doing it for years, I mean, don't change that. Get in that nasty rounded back posture. Pull if you need to pull 600 pounds off the floor. Everyone's saying like that's how you're gonna blow a disc and things like that. And we have plenty of evidence and research and just um, on the floor even, but also too documented that that's not true. Um, and so I think getting hung up on um, that those extremisms of, you know, oh, it doesn't matter what you do, just do it anyways, versus you have to throw exactly the same way each time, or you have to deadlift perfectly, no matter what the load is. Um, I think that gets people in a lot of trouble, and I think that's uh, in regards of just psychologically, but also to injury creation. Um,
Mm-hmm.
And so things like tantrums, things like end range isometrics, get used to that. You being able to spend more time during a heavy load in that position, um, I think is extremely important.
Yeah. The thing that I keep going back to is like, obviously we know like injuries happen for a reason, and like form is important, but we also understand that form like isn't as important as like people are like making it out to be.
Hmm.
how how would you tell someone to like balance that? Like how do we know, um because me as like a future clinician, I want to be able to prevent injury in my patients as much as possible,
Of
but
course.
then like I don't want them to be hyper aware of like every single thing that they do. And when I'm watching them, let's say do a squat or do a deadlift, like what
Yeah.
should I be looking out for if like I don't want to be hyper vigilant about everything?
Um, so that's a great question. That is something that I had to work on and I'm still continuing to work on, um, in regards to over explaining it or under explaining it. And I think this is where a lot of the research and I what goes towards like external cueing, versus internal versus external cueing comes to play. And then also too, listening to your patient, because patients, if they're going to be hyper vigilant or just again lackadaisical or anything in that regard, you have to figure out what they're actually trying to tell you. So let's say if um, you have a very anxious, very involved patient, um, and they're trying to tell you, you know, what their idea of perfection might be or is, or with whatever movement they're trying to do. Um, I You either have to figure out how to get what you want from the patient with as little words as possible, or sometimes you have to kind of get down in the nitty gritty and explain the detail and explain why these things just don't matter, or why right now is not an issue. Um, really trying to figure out how can I get this person to trust themselves to do the task without judgment. And so you're kind of in a way, sometimes I'd hate to say it, like a behavioral therapist, but you have to figure out what they're actually trying to tell you or trying to say, and then meet them in the middle, um, without pulling them or pushing them in one direction. So that's it is difficult because as clinicians and especially as students, we have all this information. We can't get we're so excited to just tell someone about it. And if you have someone that's actually wanting to listen, you can just word vomit all over them, and they're just so lost, if you will. And so um, I would start small. If I were to be a clinician, an intern again, I would figure out how to communicate external cueing very well and be quiet. I don't know if I would go into as much detail. I'd probably let them know that right now, let's just see what you do, and then we'll go from there. And let them know that movement is a spectrum, not extremism, and that perfection is a coalescence of those extremes. Um, and so, my idea of perfection and your idea of perfection is two totally different things. Um, let's If I do see something, I hope that you trust me to that I speak up. And if you feel at any point uncomfortable, or if you have any other thoughts that you want to move forward with, I trust you to communicate those with me. Um, and so there has to be that's kind of like needs to be a relationship there. And so um, I think something that I've been trying to do is just be quiet. There's so many ways, like all roads lead to Rome. Eh, It's all good. Now, if you the progression's weird, right? Or if maybe the if something or the exercise just looks way too lax, or maybe or the interns, and this doesn't happen too often, but maybe the intern is just too focused on what their idea of perfection is. Of course, I'll say something. Or if the patient is something like that, also has those um, uh, ideas or is communicating that, I'll say something. But most of the time, it's very difficult for me, as I'm sure you know, uh, just trying to be quiet, and we'll we'll get there. Um, is kind of what I would give to my past self.
Yeah, just say a little and then see what happens.
Just say a little bit. Give the patient time to practice it, and give them give them the confidence that they need just to be repetitive and make mistakes. Because most of the time, especially high performing athletes or just high performing people in general, they don't have the sandbox to play. They are they need execution, and they need perfection at all times,
Mhm.
and they get caught up in that. And so you may be very well the first person that just says, let's just play around, and no big deal. You know what I'm saying?
Yeah.
And to
Is there a
some people,
point where perfection does is there a point where perfection does matter in a movement, or would you say no, not really?
what's per- what's perfection? I mean, what what does that look like,
Like, I'm
or
thinking
how is that
of
defined?
like if you had a power lifter.
Yeah,
No, that's fair.
I mean,
Yeah.
when in regards to it's so hard to figure out how that is even defined for one person. Because I can guarantee you right now that my idea of perfection and my wife's idea of perfection are two totally different things. Or one idea versus another of how we're going to do something. Two totally different things. And so in a clinician and patient relationship, it's the same thing. You know, what's just trying to find the better way to think about it is trying to figure out what each other's expectations are. What's we're reconnecting. What what's the patient wanting from me, and kind of figuring out how they want me to communicate it, and then what I want from the patient. Of course, usually it's pain-free movement at whatever volume they're trying to do.
Mhm.
And so that's probably as perfect or that you want to get there is identifying and defining expectations within care. And quite honestly, there's patients sometimes that once we kind of figure out what we want from each other, and usually that's the first, second visit, uh, they're not a good fit. I mean, had you. There's times where um uh they're the patient is wanting more details from me, right? And again, I think it's more of a failure on my end versus the patient, but they're wanting more out of me than I was at the time willing to give, because a at the time maybe I didn't know how to explain why it didn't why I think this way, or why we're doing the and got more focused on the progressions, versus the patient is trying to just extract more detail. They just wanted more information because they were curious, and so it's tough sometimes to figure that out. But when it comes to perfection, figure out their body type, figure out what they want from you, and you can keep it at that. And by body type, I mean like hip structure, right? What they can't do at their end ranges, things in that regard.
When I guess what I struggle with personally is like, okay, I get in when a patient comes to me and I like they're dealing with some sort of pain or something, and it's like, okay, we need to find some pain-free movement, and whatever
Hmm.
that looks like is
Hmm.
what their body is going to need and move like and stuff like that.
Hmm.
But let's say like I have an athlete that wants to like improve their performance or like
Hmm.
prevent future injury.
Hmm.
To me, I'm like, okay, there's certain movements and things I need to be looking out for. So let's get more specific on like the type of athlete. Like let's say we have a power lifter, for instance, and we're going back to that deadlift. We're like, we don't want there to be like a herniated disc or like that lumbar flexion. Like we maybe like don't want to have that, but now research saying is like, it's not that big of a deal. Like where do we draw the line of like, well, it needs to look like some sort of deadlift to prevent pain, and people get injuries from doing deadlifts. How do I keep that from happening?
Then, yeah, I would, of course, not move into the extremes of heavy lifting, right? Um, I would get them in a weight that's very, very comfortable for them. And at max, maybe even go 50% of
Mhm.
their max. But when you first initially do it, I mean, go significantly below that even. Um, so, quite honestly, initially, you would, even if the patient had pain or they just wanted to utilize performance, um, I would start programming uh, isometric work in their program. So find out which, like, if they've gotten injured before, if there's any uh, positions or patterns that they've gotten injured before, and I'd spend more time in those positions. So let's say if the patient had a lumbar disc herniation in the past, now they have no issue, they just want to do more performance, but always kind of think about this disc thing, and so they don't want a re-injury since they're getting to a competition. I would make sure that we're not going into further ranges of motion of what they are already used to. So if their coach, or if they saw a YouTube video about, anterior versus posterior pelvic tilt, and that one's better than the other, um, it's just not trying to change that pattern. It's especially in a loaded sense. Um, if they do want to change the pattern just because they don't like how it looks and they want to be stronger in that pattern, then they just need to start at significantly lighter loads and just increase the reps. Um, because it's a movement skill, it's a movement acquisition, right? And you have to get the tissues, especially like a disc or the spine. The tissues just need to be adapted to that load, that movement. Hey, buddy. Um, oh man, I'm actually I'm on a podcast. I'm on an interview. Um, so I'm gonna keep talking, okay? Oh man, it is broken. Um, so Ollie wanted to show me his broken book light. Um, and so when being able to get the tissues accommodated to that load is the most, like, the first and foremost uh, area. Now, if they don't want to change their positions and they just want to get stronger in those positions, um, I would uh, uh, give them isometric work in those positions that they feel weak in. Spend more time in those weak positions, and then um, a- as you kind of watch them do that, figure out how to regress those positions. So if it's like a hinge or a deadlift, right? Um, put them on their knees and put a kettlebell behind their back, right, and have them do hinges from there. Or being able to, if their intra-abdominal pressure needs a little bit more work, or if they kind of lose it in while they're all scrunched up, whether that's bottom of the hole or in the hole of the squat, or at the beginning of the deadlift position, um, uh, put them on a bench and give them a band to pull onto, and give them some, like, crunching work, and have them just concentrate on that area. Um, while doing expansions and what have you, and then move back. So kind of like facilitating that, then move back to the deadlift and practice that one skill that they were practicing with that one exercise, and bring it to the deadlift immediately so they can feel that difference, and then do repetitions from there. Um, and so uh, And I think too, and someone and an athlete that's been doing, like, that's been doing this for years and years and years, bringing a something novel to them does um does does a lot of work too. So isometrics is one thing, but sometimes that's not novel enough. Um, but everyone forgets about split squats, or some type of uh, uh, split 90-90 hip position in the hips, something in that regard, or maybe even doing a couple of pull-ups before a deadlift. I mean, if you do a couple of pull-ups, or some type of drill there, your deadlift does change. And so, or it feels different, I should say. Um, and so, spending more time in the weak positions and then adding some uh, novel movement, I think will go a long way.
Yeah, it's almost like we have to get out of the thought process of like just thinking we're like influencing the muscles when we're building strength, and you're influencing all the tissues. And
Right.
then now to me what it sounds like is like, okay, let's say you have an athlete come in and like they had like they're nervous about getting a herniated disc
Sure.
due to past. You can look at it, see what's going on, but then it's like not only are you like building back up the tissues to help stabilize, but like, or the muscles to stabilize, but you're also like building back up the discs to be like in that
Yeah.
position. So you have to like think of it as a slow process. Um, it almost makes me think about like when people say you like play tennis or golf and like you want to have an instructor to like teach you, because then you have to like unlearn all the bad habits if you get an instructor later.
Sure.
It kind of sounds like the same thing here, but it's a little bit more sensitive in the fact that like we're dealing with weight in different tissues.
Right. Right. Well, and quite honestly, um, what how I think about it is you're creating a relationship with it as well, right? You're not just getting this the tissues adapted. You're building that relationship with it, and so you almost have to think about, especially with if you're trying to figure out expectations, right? With the patient, and the patient's trying to figure out you, is looking at a patient as a person, and then what their goals are as almost as another person. So if their goals are to get out of pain, or if the pain has been influencing them in some way, or the goals have been influencing them in some way, what you almost kind of what you want to think of it as, or at least what's helped me anyways, is we have the patient as just a person that you can hang out with, right? And then their goals as another person, and your job is to make that relationship happen, or a lot easier, if you will. So
Hmm.
if it's insulting pain, and that he's, you know, uh, an abusive relationship with the patient, your job really is to figure out, okay, how can I uh, make that relationship better for them. And so I think there's a large um, component there.
Yeah, for sure. You had mentioned isometrics.
Hmm.
Why are isometrics in your like mind like so important to rehab?
Yeah, I think it's important to rehab because you can safely, again, it does so much to the tissues in regards to um, uh, modulating pain, right? Um, we can get to the fact of uh, come on. And so I wrote a couple of notes, I think, around here. I'll get around to them maybe. But with isometrics, there's just so much that happens in regards to getting to the end range, so kind of feeling that stretch, then working from there and being familiar with that that movement, and then creating force into that area. I mean, so much happens, not just the muscle and the tendon, but the articular surfaces, right? The all the other neurology that happens in those uh, and those in that anatomy, where you're increasing the confidence, and modulating the pain in those positions of something, again, of where they already have a poor relationship. And so I think isometrics are so important, because it's so low risk of injury. you're creating confidence with the patient in the positions that they're not familiar with or they don't want to be in. And at a brain level, you're changing the pain sensitivity uh, there. So you're practically doing manual therapy, heavy exercises, and creating at least a foundation of boundaries within a relationship. Um, so it's almost to the point where I feel crazy always saying isometrics first and then move forward. I mean, you've heard that plenty of times in the clinic of some sort of with patients, because there's so much um, neurologically and so much physiologically that happens locally with isometrics, that I think it's almost too important to not- or to it's so important to perform, especially when you're introducing
Yeah.
a new movement. Um,
Yeah. It's so crazy how you not moving your body and just like being in one position can influence your entire system.
you got it. I mean, the perfect posture is the next posture, right? It's the same thing with movement.
Yeah.
The perfect movement is the next movement, uh, and so um,
Mm,
it, trying to get that idea communicated in multiple ways can be difficult sometimes.
yeah. It if you like had one piece of advice for any intern starting in the clinic or someone trying to get back into like movement, what piece of advice would you give them?
Um, I would try. I'd give them. I let them know that it's not that it's not as difficult as it may seem. All roads lead to Rome, but being able to
Mhm.
uh, organize your thought process and truly like write it down. Write down your exam flow. Write down at least rehab concepts of what you think you know and what you want to know. Um, I think that's
Mm,
where a lot of the communication of figuring out where what the things that you don't know and the things that may interest you, and also to how to communicate it. I think writing things down and creating a system of thought is like the foundation of where everything else is going to come from.
yeah. No, that's
So
really good about if you can't write it down, then how do you believe that you're going to be able to say it?
write it down. Write it down. Write down your exam flow, and
Yeah.
and figure out like what is this good? Is it bad? Write down your even a most recent conversation that you had, um, and then figure then ideas will kind of explode from there. And I think you should run with that creativity
Mhm.
because writing is creative, rehab is creative, um, and being a clinician is creative, and trying to get a creative outlet to I think is very important, especially when you're first starting out.
For sure. Well, Dr. Beckerman, thank you so much for being on the podcast.
Hey, I appreciate you inviting me. Thanks for having me. Sorry for the little hiccup with the internet, and of course Ollie's guest appearance, which I don't know if he appeared on the camera at all, but I appreciate you having
I
me.
don't think so, but we loved hearing him.
Yeah, yeah, he's a cutie.
Of course. Thank you so much for listening to this episode of Becca Babbles podcast. If you enjoyed this episode, the best thing that you can do is leave a 5-star rating and review on Apple Podcast, Spotify, or any other listening platform of your choosing.
If you want to learn more about me, you can do that by following me on Instagram at Becca and Wellness, or by checking out my blog, freebies, offers, and newsletter on my website at beccaandwellness.com. If you want to share the love of the podcast, you can do that by taking a screenshot and sharing it on social media and tagging me and the podcast at Becca and Wellness and using the hashtag Becca Babbles Podcast. I hope you have a great rest of your day, and I can't wait to babble with you next time.